All right, so my name is Adolfo. I will be the chairperson for this discussion assignment. I'm just going to uh, try and read it real quick so we know what we are answering. The scenario says you're a student, it is a busy day at your clinical site. The imaging department is understaffed, creating a stress mood as the techs move through the department at a frenetic pace. You are assisting with an outpatient exam. When you call the patient back to confirm their date of birth, you realize that they do not speak the language, your language, and cannot confirm their identity. You inform the tech of the situation. The tech tells you that it is the correct patient because they are here for a scheduled exam and to begin the procedure. What do you do? And so my answer was um, I would not continue with the exam until I verify the patient's identity. I will go back to the reception with them and find a way to ID them, taking 5 to 10 extra minutes, even if everyone is in a rush, is the correct and professional way of doing things. The last thing anybody wants is to expose the wrong patient. That was my answer. Anybody has any comments?
Um, I would agree too, like going to the front desk and asking for their, insurance, maybe their identification. They could take out their ID, and then my hospital has like a video remote interpreter. It's like a FaceTime.
That's awesome.
Yeah, so they could probably do that too, just to select the language and make sure it's the correct patient.
Yeah, that's very convenient. And yeah, I mean, at first I will try to communicate with him, even with signs, taking out my wallet, showing them my ID or something, but if that doesn't work, then find out how the main desk got that patient into an scheduled exam in the first place. But okay, I'm gonna go in order right here. So let's go with Kimberly.
For my site at BCMC, I've seen little cards so that has like a whole bunch of different languages. So for translators, I'm sure every hospital or clinic should have a translator. Or even asking like your coworker, oh, do you speak this language? Like someone's bound to know.
Yeah, I think that's something that we even saw in the orientation. Well, at least for the hospital that I'm currently going to, they did have the information for translators, emergency and numbers and such. But yeah, I think that's the way to go, because even if you're a student and you know that the tech has way more experience, I don't think it will be wise just to do things blindly. All right. And then let's go with Crystal.
Um, well, yeah, I think it's about the same thing. Like I would probably check with another tech if they speak the same language or even try to communicate with them. I feel like there's like a lot of different ways. I could even try like the video interpreter and then maybe try that, select the language and try to do that in order to get the information. Cause I think it's just too dangerous to just be like, okay, like that's you and take them back.
Yeah, exactly.
Yeah.
Just exposing people around. No, I mean, I think I'm not the only one that already saw some weird things at the clinical sites. I mean, markers are not a thing. But yeah, okay, let's go with Irene.
So I was gonna say the same thing that Crystal said. At my site, we have a translator. It's like a little iPad, and you just click the language. I also thought if your site doesn't have that, you could possibly even try Google Translate if you knew the language the patient was speaking. So
Yeah.
that's what I would do.
Yeah, that is actually very smart. I just recently saw a video of a bunch of guys. I think it was a TikTok, and they did exactly that. They pull out the Google Translator, and they knew that the person was speaking Spanish, so they just put it Spanish
Mhm.
English and show it to the person, and they already knew what it was. So that was very convenient. Okay, Angela.
Well, I think it's important to use all your resources, as everyone was saying.
Google Translate, maybe a coworker. I think every hospital or facility probably has an interpreter or an iPad that is available if you have anyone that speaks a different language, as well as seeing if they have a family member there with them who speaks the language and is able to kind of translate between you and the patient. Because most of the time there is like a family member there, depending on where you're working. Maybe the family member doesn't come in, but I think that would be easy too if you have a family member there that speaks both the language and English. If you could tell them, are they able to show me like an ID and confirm? That's another thing.
Yeah, absolutely. And like you said, use all of your resources, every option you have. Even another one would be that if the tech is so sure, then let them do the exam and try to take over on whatever they were doing, just switch places. I mean, if they are okay doing that, or at least in this scenario, yeah, we know that it's wrong and we wouldn't do it.
Yeah.
But, okay, and lastly, Kendra. I don't think we can hear you, Kendra. That's weird. Yeah, you're unmuted, but can anybody hear her? Or is it just me?
No.
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 If you're unable to fix it, you can type on the chat right here and we can read your answer, or even just a text message if you want. I don't know Zoom very well. Like I didn't know how to schedule a meeting, so.
Yeah, I'm not sure if it'll.
All right, I think she's typing. Okay, she's saying that since she's the last one, we pretty much cover it all. She says, I will definitely tread lightly with the technician since we are guests. Exactly. I mean, as students, we can choose not to do something if we don't feel comfortable doing it.
Mhm. Yeah, I think it's important that sometimes it is scary, like because we're new, like still telling them, no, I'm gonna double check, but still not getting like intimidated or feeling like you can't still double check yourself, just make sure you're still covering your bases.
Yeah, absolutely. Because we are the ones that can get kicked out for doing something that we know we're not supposed to. And she also said, I think I will try to gently remind the technologies that due to our school, we need to follow HIPAA and rules, regulations. Exactly. I mean, especially if it's not a stat situation like a trauma at an emergency room, I'm pretty sure you can take 3 to 5 minutes just to double check the ID of the patient. But all right, I think we covered it all. Does anybody else have something they want to add? Or okay, she also said I'm in the same location as Irene, so we do have a translator. That's cool, and Google Translate will work too. Definitely. I mean, we all have a phone, so we have it right there. Anybody has any questions? Nothing. Okay, we went through it pretty nicely. Okay, I'm going to end the recording.